It's corny as fuck, but you know it's true. What is the one accessory that everyone needs and deserves on their wedding day? A confident smile. And no, I'm not talking about that fake grin you'll plaster on when Aunt Karen puts that lacy satin horseshoe thingy on your wrist. And let's be real, your fiance didn't say yes to your resting bitch face. Today, I am chatting with your dental fairy godmother, Dr. Naomi Goldman, about how engaged couples can plan to rock their very best smile. Naomi will teach you the transformative role of cosmetic and restorative dentistry in enhancing smiles, particularly for weddings, the top 3 treatments engaged couples are investing in, a patient story that really illustrates the incredible emotional and psychological benefits of a great smile, the main differences between at home and in office whitening, plus make sure you stay listening to the end to learn the 3 foods and 3 drinks you want to avoid having directly after treatment, which will make or break the effectiveness and how long your teeth look fabulous for. Naomi also chats about teeth grinding, jaw clenching, wedding stress induced dental problems and what you can do about it. Let's get stuck into it. Unbridely is a community of pro-wedding vendors who believe in freedom and integrity in weddings, giving you options, solutions, tips and tricks to create the experience and memories that you and your fiancé really want and deserve. Because we believe that weddings are a team sport. With how-tos, stories and interviews with recently married couples, we find out what went right and what they'd change if they could go back and do it all over again. I'm Camille and welcome to the Unbridely podcast. Hi Naomi, thank you so much for joining me.
Thank you. Thanks for having me.
Really appreciate it because you're on the opposite side of the world to me, and we just had a quick chat and you've only just put your kids to bed. So yeah, I really appreciate you going out of your way, and it's okay for me to call you Naomi?
Yes.
Dr. Goldman?
Yeah, Dr. Naomi, Dr. Goldman, Naomi, it's all good to me. I don't
Okay.
all good.
That's great. Well, yeah, so we're here to have a chat about your expertise as far as a wedding smile goes, but perhaps you could tell the listener first, like who you are and where you are on the opposite side of the planet.
Sure. So I am a cosmetic and restorative dentist, and I practice just about 30 minutes outside of Boston, Massachusetts in the US. And what I really love to do is enhance people's smiles, make them feel confident, and also to educate them on ways to keep their smiles looking good and prevent damage over time.
But see, that sounds really good, Naomi, because it's not just about the one day then.
Yeah, absolutely.
You know how like with weddings, they go, hey, have this, have that. And you go, sure, for one day.
Yeah, I know. And it's like you're investing so much money in your wedding and everything. I don't know if it's the same over there, but I remember when we were planning my wedding, it was like everything that you decide to do is $5,000. You want lighting? It's $5,000. You want flowers?
Starting price.
It's starting at $5,000. You want a dress? It's $5,000. So it's like, if you're going to invest in something and you want to invest in your smile and you invest $5,000, well, that you get to keep for the rest of your life. It's not just that one day, like you said. So
yeah,
it's worth it.
I love that. And so what sort of role does cosmetic dentistry play in boosting confidence for like major life events like weddings?
Yeah. So, everybody wants to have a nice smile in their wedding photos when they look back. And I think it's just like everybody wants to look their best for their weddings. And I notice that whether it's for a wedding or not, people come to me and they say, I just want to be able to smile in photos, whether it's photos with their kids, photos for their wedding, photos for a shower or something like that. They don't like the way they look when they smile with their teeth. And they just want to be able to like kind of forget about that and just smile naturally and show that they're really happy. And sometimes they don't even know that until after the fact, but they come to me and they just want to be less embarrassed about their teeth even. But after they have their teeth fixed, It's amazing what it does for their confidence. I see it immediately. They smile at themselves in the mirror and like they're just a different human. All of a sudden, like they're just so confident. Like this whole personality comes out because they just are so free of this,
Yeah.
self-consciousness that they have about their smile. And all of a sudden it's gone. And they smile so much bigger and they look so much more joyful. And so of course that's something you want on your wedding day of all days.
Yeah, absolutely. I mean, there's the link
Yeah.
between smiling and releasing of the hormones in your brain
Yeah.
to say you're happy,
Yeah.
and it goes both ways.
Mhm.
So, yeah, it enhances your entire experience of life.
Exactly.
Just, I
Exactly.
mean, on a really small scale, my daughter, she's 12
Mhm.
and she's got the teeth of a 12-year-old. They're a bit all over the place. The big ones are still
Mhm.
coming through. And she can be absolutely ecstatic about something and she won't show it on her
Yeah.
face because she doesn't like her smile.
Mhm.
It breaks my heart.
Yep. Exactly. And then once she gets them all in the right place, she's gonna smile so big and it's gonna just bring her more joy. Any like just physiologically, just to
Right,
smile.
literally. You experience a better life,
Yeah,
which just, it's amazing. You must get so much out of doing this for people.
I do. It's like it's really just a different type of, I guess, like practice. It's like when I went into dentistry, I didn't really know that I would go into cosmetic dentistry, but I just fell in love with that aspect of it. And it's such a different job. It's like
Yeah,
you don't go into the office and have people that, all you do all day is fillings and no one wants to be there. You go in and you're changing people's lives. Like it's just like such a different thing. And I just like have such a passion for it. It's so much fun.
yeah, yeah. So, okay, so these people are coming to you. Sometimes they know that they just want to smile, and other times they're
Mhm.
just going, oh, maybe I should do this for the fiance or something.
Right.
So, what are the most common dental treatments or enhancements that you're finding couples coming to you to get done before their wedding day?
I would say top three are whitening, of course. That's the simplest one. So we have a ton of patients come in just for a quick in-office whitening treatment the week before their wedding. Number two would be Invisalign. So
Oh,
straightening their teeth. That's a huge one because a lot of people, especially I feel like most people getting married are in their 20s or 30s. A lot of people have really nice teeth. They're just not in the right place. Maybe they had braces when they were teenager and then they didn't wear their retainer and now they need to move them again. So it's something that should be planned because
mm,
obviously Invisalign takes time. And so it's something to think about, before your wedding. You want to give yourself enough time. Most of the cases that I personally do take around 6 months, but it depends on the doctor that's treating it. A lot of Invisalign cases can take a year or even longer. So it's something you'd want to look into, with enough time. But generally, I find people do come with enough time. They come to me about a year before their wedding and we straighten their teeth and then usually whiten them at the end. And that is like so transformative. Those two things combined, very transformative. And then number three would be veneers. There's multiple types of veneers, but some sort of veneers to correct the color or the shape of the teeth. I would say that's third most popular.
I'm just so shocked, Naomi, about the Invisalign treatment that it
Mhm.
can be as short as 6 months
Yeah.
for some people, some
Yeah.
cases, I'm
Yeah.
sure. But
No, it's actually a lot. It's actually most of my patients, their cases are anywhere from 4 to 8 months, and the average is definitely 6. So Invisalign has come a long way, really long way, and the technology is amazing there. So, yeah, it's getting faster.
that's really just such a gift, I think, for the person going in there, getting their teeth, whether it's straightened, whitened, with the veneers. But how about the fiancés? Like, do you have
Mhm.
any memorable stories of patients and what they've asked for and their results?
Well, it wasn't a wedding story, but there's this one girl that she's probably in her 30s and she had recently gotten married. But she said that when she smiled, she just didn't feel like she could show happiness in the way that she wanted to, kind of like we were talking about.
Mm.
She always said she just felt goofy when she smiled, and she had a lot of spaces between her teeth, and they were really worn down. And so we did a lot of treatment on her. We did Invisalign, and we changed all of her gum heights to make her smile less gummy. And then we did veneers.
I didn't know that was a thing. Sorry, I didn't mean to.
No, yeah,
So,
yeah.
sorry, lovely lady out there who had that done. I didn't know that was a thing. Less gummy.
So, like, yeah, some people just show too much gums when they smile, and you can change the gum heights so that you're showing less. So, when you move teeth, you can adjust the gum heights as well. Yeah, the gums have a lot to do with the aesthetics of teeth for sure. So, we changed like everything. And when we were done, she said, like, I feel like I'm smiling like myself now. Like when I try and show happiness, it comes across the way I want it to come across. Like,
Wow.
and she later sent me a photo, like months later, of herself, just like she was out somewhere in Colorado and she was laughing and smiling so big. And she posted about it on Instagram and said, like, I never would have taken this photo or posted this photo because I was smiling so big and laughing. But now I have the confidence to do that. And it's because I had this whole smile transformation done and it has changed her life. So, I mean, she's one of my favorite patients just because of who she is. She's just like a really lovely person. But yeah, I just love how she described it. Like in the beginning, when she tries to show happiness, she just doesn't, she feels goofy when she tries to show happiness. I'm like, oh, that's horrible.
Isn't it?
That's just like you feel not aligned in yourself.
Yeah,
And
literally. I was just thinking about, all the things that people do for their weddings in particular, but all through life.
Mhm.
And a friend of mine who is also one of my past grooms, he's a communication expert.
Mhm.
And he was recently on Diary of a CEO, the podcast, and talking about all the different types of ways to communicate and, using your voice and using your instrument and things like that. But if you can't communicate your emotions, it's half the picture, isn't it? Like your
Yeah.
patient wasn't free.
No, she isn't free. That's what it is. It's like a freedom that comes with that.
Yeah.
It is. It's like a weight lifted off your shoulders when you can finally just smile. Just like smile and show your teeth. And there's so many people that laugh and they cover their mouth when they laugh because they don't want to have people see their teeth,
Yeah.
or they'll position their lip in a way that it hides their teeth when they laugh or they smile or they speak. And it's just like you can see it inside them that they're so ashamed of their teeth. And it's just like so uplifting. You can see it in their demeanor
Mm.
between the before and the after. And yeah, that's my favorite part. Just seeing that change in people.
Yeah, that's wild.
Mhm.
And what about, can I ask, for couples coming to you who might be about to get married, they're probably in that 20 to 30-year-old bracket,
Yeah.
age bracket. But do you have some sort of older clients who come in who maybe didn't even understand the technology available to them, and how far they've advanced? Like you were saying, Invisalign has come a long way,
Yeah.
and they're shocked by what you can do to help.
Oh, absolutely. And the other thing that's interesting is that many patients in their 50s and 60s, they say, "Well, I'm too old to do that now." And I think it's crazy. I'm like, you've lived only half your life, and you're not too old. And if anything, it's like a new wave of people doing Invisalign, especially. I see in their 50s and 60s, they've paid for their kids and they paid their kids college, and now they finally have money to do things for themselves. And it's not only an aesthetic benefit, it's actually way more of a functional benefit than an aesthetic benefit. So we're treating tons of patients in their 50s and 60s for function, but also for aesthetics. In the end, they love their smile too. And it's like, well, now you are going to prevent so much dental work and dental disease and dental trauma because your teeth are in the right place and they're functioning well.
Yeah.
And it's that prevention that's going to like allow you to keep your teeth for the rest of your life. So it's huge. And we just have the tools to educate people now that we didn't have before. And now with the technology on top of it, it's like, to me, it's a no-brainer. I'm like, why are you not going to save your teeth? Look at how they look now. And let's just fast forward this, 20 to 30 years. We can imagine what's going to happen. We can show them kind of like where it's going. And we have the technology to be able to show them how their teeth would look if they were straight in their face with a picture of their face. So it's like, it's amazing when you see yourself with straight teeth.
And it's not as scary, surely, for your patients to be able to, for you to be able to fast forward what's going to happen. There's a whole sense in, normal dentistry where, I floss today and I've got no idea really. I've been told it's the right thing to do, but I've got no idea in 40 years' time whether that's, actually going to make a difference. But you literally have this like fast forward time machine, don't you? To be able to show your patients what they're going to look like.
Yeah. With digital scanners, it's amazing what we can show them and how accurate it is too. I've compared some of the outcome simulations to the actual outcomes, and it's scary how close they are. It's very close.
So cool. You make me want to go to my dentist, which is really weird, Naomi, I've got to tell you.
I'm sure it is.
Did you know that most newlyweds spend up to 8 hours of their precious time working through changing their last name after they get married? This is where Easy Name Change comes in. Their kits provide you with a sort of shopping list of businesses, companies and government departments where you simply pick which ones you need to notify. They then send you detailed instructions on how to go about the name change process because every business is different, and this saves you hours of calling around, waiting on hold, sending emails, waiting for a response, and then remembering to follow up when you don't hear back from them. Easy Name Change kits also provide ready-to-send forms, letters and emails, so you just attach your marriage certificate to them and you're done. Starting at $39, the value and time you get back is a no-brainer. For more help on changing your name after you get married, there is an excellent blog post on the Unbridely website, and I'll put a link in the show notes for you. Plus, Unbridely podcast listeners get a $6 discount on their name change kits by using the code Unbridely6. That's UNBRIDELY 6, the number 6, and this is valid until the end of 2025. Get your Easy Name Change kit so you can move on to the fun parts of being grown-ups together, like holidays, getting a dog, building a house, herb gardens. So we would go to you, or we would go to a trusted professional, and we get these things done. But then, in the back of my mind, it's like, what about that black tea that I drink every single morning?
Oh, yeah.
Like, are there particular foods, drinks, what is the maintenance like, especially when you're having the teeth whitening?
So with teeth whitening, it's interesting. There's two types of teeth whitening. So you have your at-home treatments and your in-office treatments. And I guess I'll just, mention some things that most people don't know. Really, you need to look for, if you're doing an at-home treatment, you need to look for an active ingredient. I'm not sure if it's the same where you are exactly, but in the US, the two active ingredients are carbamide peroxide or hydrogen peroxide. I would guess it's probably the same for you, but basically, those are the two types of bleach that are in the whitening agents that are actually going to whiten your teeth. If there's no peroxide in the product, it's it's just not going to do anything because that's how whitening treatments work. So when people look at whitening toothpaste, there's generally no bleach in there. What whitening toothpaste is doing is it's an abrasive that's removing surface stain. So that coffee stain and tea and things like that that stick to your teeth, it will remove that, but it's not actually whitening the inside of the tooth. So if you have a product that has that active ingredient of one of the peroxides, what happens is when you use it, your teeth become more absorbent and more porous while you're whitening. So they will absorb whitening treatments better after the first day or two. They will kind of like soak up that bleach better, but they'll also absorb stain. So that coffee, tea, all that stuff, they're going to want to pick that up too.
Of course.
Of course. Yeah. Can't have it all.
Makes sense.
So the key is to do the whitening treatment back-to-back days so that you get the benefits of that porosity of the tooth, but to avoid staining foods and drinks for all of those days, which is very tough to do because we all want to have our coffee and tea and caffeine. And not only do you have to avoid it during those days, but for an additional 24 to 48 hours after you finish your whitening, because that is how long it takes for that tooth to go back to normal, to rehydrate and kind of seal up. And then it will be just a normal amount of staining that would happen.
Okay.
So you'll actually have benefited from the whitening treatment. So that is why a lot of people don't see results with the at-home treatments unless you're someone that just doesn't drink coffee and tea, and then you're just fine. The other things to look out for are things like tomato sauce, blueberries, and spinach. Obviously, red wine as well. Those are some of the most other staining food and drinks. Yeah, spinach, blueberries, tomato sauce, red wine, tea, coffee.
Is there something specific in those foods?
I don't know what it is. I don't know. I know that because the spinach, I think I found when I was just doing research, but blueberries, I see patients that come in with tons of stain on their teeth and they don't drink coffee or tea. And it's a darker stain. It's like more of a black color. And it's blueberry smoothies. Like they have a smoothie every morning with blueberries in it and probably spinach too. Yeah. And that stains their teeth a lot. So it comes off with a cleaning, but it's a different color stain to regular coffee, tea, or like smokers, which is typically brown. It's just different.
Yeah.
So those are the things you want to avoid with your at-home whitening. Conversely, if you look at in-office treatments, it's like usually a single day. The difference is that the
Wait a minute. Seriously? One day?
1 day, one hour usually for an in-office.
Why are we doing that? Why are we doing that?
Right? Yeah, it's more expensive.
Oh my gosh! Sorry. Keep going. Okay, 1 day. Let's go. What do I have to do?
Right. You just go into a dental office and they'll whiten your teeth for you in 1 hour usually. And then you just have to avoid the staining foods for like 1 day. So I'm like, okay, that's more doable, right?
That's not even worth talking about. Seriously.
Yeah.
I was sitting there with my blueberries and my, tomato sauce out of the fridge and taking away the spinach and stuff. And, no, who could be bothered?
Right?
You do it.
Yeah. That's what I'm saying. So when people want to do, it's because it's like, the cost. So they can go get an at-home treatment for $50. And then to have it done professionally, it could be $500. But for me, I'm like, I'd rather just spend the money and have it done and be done.
I'd rather save up that money, know that it's done right, know that, it's going to stay, that I haven't done something wrong, that the peroxide level is high enough that it's actually going to make a difference. And how long does it last for, Naomi? It's
very dependent on the person. The results, of course, are dependent on the person because everybody's teeth kind of absorb the gel at a different rate and also can have different thicknesses of all the layers of the tooth. I'd say an average in-office whitening treatment lasts about a year for most people. Some people it can last longer, and some people it can last less. But I would say the average is about a year. And I don't think you ever go quite all the way back to where you started, but you'd want to do a touch up again after about a year. And sometimes it's enough to just do 1 or 2 nights with some at home treatment. And that's enough to get you bright again because you haven't gone all the way back. And,
Yeah,
one or
you'd
two
have a
nights.
higher baseline
Yes, you have
color,
a higher
if you like.
baseline. Exactly. So if you have an event that you want to just like brighten them up for, you just, throw on this crest white strip or whatever you want to do at home. And you can just do a couple days here and there. And then if you start to notice things start to really darken, then you can do a whole treatment again. But I feel like that's typically what we see.
Something that just came into my mind, I'm going, okay, yep, you've completely sold me. I'm in. Like, let's go. Let's get these teeth whitened. But then, like, I worry a bit because I'm a bit older as well. Worry a bit about sensitivity. Is that still a thing with teeth whitening?
Still is a thing. So in my office, we happen to find this treatment that's really good for sensitivity. I would say it's not quite as strong as some of the other in-office treatments out there, but the price point in my office is also a lot lower and there's no sensitivity. So you could do 3 treatments in my office for the price of 1 in another office. And then I think the results are actually going to be higher over time. So you have to come
Yeah.
back a couple more times. But, if you come every 2 to 3 weeks and do a completely sensitivity-free treatment, I feel like for me, that's better than having the tooth sensitivity because I've been there, done that, and it's not too fun.
I love that you care. I love that you give a shit that, your patients are coming in, that they get the best results, but
Yeah.
also are taking care of their teeth for the long term.
Yeah. I think like we really put a big emphasis on education and prevention. And so I know people have this thought out there that like, well, if you prevent all of the decay and problems, then what are you going to do? There's plenty for me to do. Like the teeth problems aren't going away.
Genetics keep you busy.
Yeah, yeah. So I'm not worried about that. But it's really like way more fun for me to work to educate people and to do preventative treatments than to be drilling and filling cavities all day. No dentist wants to do that. It's like
You don't skip to work to do that, do you?
we don't. We want to keep people's teeth healthy. We'd much rather be doing treatments that are going to keep teeth nice and healthy rather than drill into them. And there are also so many non-invasive cosmetic treatments out there now. Like there's different ways to do veneers now that you don't have to shave down your teeth.
Good.
Yeah, right. I mean, it's
Sounds better.
right. Number one thing I hear is like, I want to change my smile, but I don't want to shave down my teeth. I'm like, great. We can either do this or this. There's multiple types of veneer options out there that can do that. And then there's Invisalign, which completely transforms your smile. You can whiten your teeth. You can do the gum lift procedure, which has 0 downtime. We use a laser. There's no bleeding involved. There's no healing time. It's like just a little bit like a pizza burn, if that, for 2 days. And that's it. And then the gums just look beautiful after like 3 to 4 days. They heal perfectly. And yeah, there's just so many things to do. And I love that. I love not damaging people's teeth and still making them look better.
Yeah, yeah. So then that leads me to think, okay, we're looking beautiful and everything, but what about these super stressed out couples? What about the jaw clenches, the they're grinding their teeth in their sleep because they're
Yeah.
having nightmares and worried about finances and stuff. What do we do for those poor people?
Well, first, we want to protect their teeth. So I always recommend night guard for those types of people. Not that it's going to stop the clenching and grinding necessarily, but it does help with jaw pain. It helps with joint pain. It helps to stabilize joints. It helps to alleviate some muscle tension and headaches that come with clenching. I know for myself, I am a big clencher. And if I don't wear my night guard, I wake up with headaches. And before
Wow.
I started wearing a night guard, I had headaches for months straight, just every day for months. And when I started consistently wearing that night guard, they're gone. I don't ever have headaches now. So it makes a big difference. And
That's incredible.
yeah.
I have friends who have headaches a lot and they have migraines and things like that. And I go, oh, that must be horrible.
Mhm.
I don't get them. I don't know why. But yeah, to think that it could be something as simple as grinding of the teeth at night.
Or yeah, I would guess that a lot of those migraines stem from clenching. I think it's very common, especially in women.
Wow.
The other thing you can do to relax the jaw muscles is to do Botox in the jaw muscles. And typically we do that, every 3 to 4 months, just like Botox anywhere else. And we just inject it directly into the main muscle that, is responsible for clenching on either side of the face. It does give a slimming effect as well to the face.
Oh, hello.
So, that's a nice little side effect, nice little bonus. No one ever minds that. But it does help to relax the muscles. So, I feel like most of my heavy clenchers that do Botox, they notice when their Botox wears off. They're like, oh, okay, I need to come back. I'm starting to get my headaches again. I'm starting to have my pain. And those people, I think, can avoid night guards sometimes because if they have the right dose, their muscles relax enough that they don't actually have to wear a night guard anymore. Kind of breaks the cycle. I feel like clenchers, they kind of get into the cycle of tension. And because their muscles are tight, they clench more and more and more. And then there's just more tension, stress in the neck and head region, and they just keep doing it. So yeah, it kind of just breaks that cycle and allows everything to relax.
That's amazing. I'm going to rush and call my friend to go, have you had this sussed out before?
Yeah.
Yeah, that's amazing. And that all comes back as well to, why can't you do something, I mean, I'm chatting about weddings, but at any stage of your life, really, that can make you look good, sure, a little bit slimmer in the face. But imagine if you felt like you
Better.
didn't have your jaw clenching, your pain, your neck pain, your headache. Like, yeah, God, you got a good job. You got a good job, Naomi.
I think so too. I really
You got a really
enjoy
good
it.
blend there.
Thank you.
I'm going to let you go, Naomi, but just one last thing. Like if you had to say something to the engaged person who's listening to this right now, who's not really confident about their smile, what would you say to them?
I would say, number one, you should feel confident on your wedding day. And I feel like a lot of people are surprised at what the options are to get there. And so you should seek out someone that you really feel comfortable with, but also that you just kind of get along with, and that you've maybe seen their work and you like their results. And you should have a consult and just get the information. I always tell people, the first step is just to get the information. I think the barrier is just taking that first step. There's fear in there. And really, there's no downside to getting the information. So just go get the information, see what it would take, and then go from there.
That's great. Don't be afraid. Go and have a chat.
Yeah. It's just a conversation.
Well, I got to say, about 60% of my listeners are based in the US. So they can just skip on across to Boston, go and see you themselves.
Perfect.
And so where can my listeners find you, Naomi?
So on Instagram at Dr. Naomi Goldman, and our website is levygoldmandentistry.com.
Beautiful. And of course, I'll put those links in the show notes as well, so then people can find you and follow do you know what I'm addicted to? The befores and afters.
Love those. Yeah, it's really fun to look at, huh?
It's hope to me, especially with this little snaggle tooth.
Oh, come on.
I look at it and I go, oh my God, anything's possible. She's just beautiful. No, it's so cool, Naomi. Thank you so much for your time. And
Thank you.
Yeah, have a lovely night.
Thank you. You too. Bye.
That about wraps it up for this episode of the Unbridely podcast. For the links and resources we mentioned, please head to the show notes. And if you love the show, please review and subscribe on the podcast platform you're on now so you don't miss out on a single episode. Thanks so much for listening. And remember, weddings are a team sport. Catch you soon.